Hi, welcome. I am Brittany with Birth It Forward, certified birth and bereavement doula, certified yoga instructor, and family photographer. So today we are going to talk about perineal massage. What is it? Why do you need to do it through your pregnancy? And how do you do it? Okay, so the perineum is the space between your vagina and your anus. So it's just a small space, but that is what's going to stretch to allow the baby to come out of the body. Um, that's where the head is putting that pressure. So here's your vagina, maybe this is your anus. Your baby's head is going to put that pressure and it's got to stretch going down this way in order to let the baby come through. So it's important for that space to have some elasticity and the ability to stretch. Um, a lot of women a lot of women find it's just not a very flexible or stretchy area of the body. It's not somewhere that we generally focus on, especially if you're not pregnant. So it does it is part of your whole pelvic floor area. It's just the very bottom. It's like the last layer of tissue. And again, it's important for it to be strong and intact, but it's also important for it to stretch. Um, so if it's stretchy, you have less potential for tearing. There could be tearing happening even if you have a nice stretchy perineum, but especially if you're fighting it through your labor. So that ring of fire that you will feel when baby is born, that is the stretching of the perineum and of just the vaginal tissue stretching to allow baby out, all that pressure. So that's why you need to do it. Now, we talked about what it is and why we need to do it. So one of the first things you're going to want to do is find somewhere comfortable. You can use the bathtub if you want, but the bathtub you don't have to use. You can also do this by yourself or with someone who you trust and such as a significant other or again, a family member. You can also go to a pelvic floor therapist, and that individual can also do a perineal massage and teach you how to do perineal massage on yourself. So one of the first things you're going to do, wash your hands, make sure your nails are clean and trimmed. Use one of those nail brushes to brush them off to make sure there's nothing underneath your nails because you are going into you're putting your fingers into your body. So find somewhere comfortable. You can lean against a bed, you can have something propped up and sit in a squatting position with your knees bent or up against a wall. You can lean against a wall, or you can even just get a stool in the bathroom and or the edge of the bathtub and have one leg up on the edge of the bathtub or the toilet even, just so that you have an asymmetrical pelvis. Try different positions, find out what's comfortable. You might find that you like leaning back in the bathtub or doing it more in the shower if that's more comfortable for you. So if you have it, you can get some massage gel, something that is safe for the vaginal area, a lubricant of some kind. Preferably something that's not a water-soluble lubricant is what AmericanPregnancy.org recommends, because they contain some chemicals that can cause some inflammation and irritation to the vaginal tissue. So in order to help make sure you are stretching properly and ensure that your tissues are getting nice and lubricated, you can just make sure that you use some gel. It's kind of why I like the bathtub. It's just nice and moist in here. So the technique to do the perineal massage, you can use fingers, thumb, whatever's comfortable. If you have someone helping you, they might find it easier to use fingers, while you might find it easier to use your thumbs or one thumb. Start with one finger or thumb and see how it feels. You are going to end up, I mean, it's pressure that you're feeling, and it's a gentle, very gentle massage. As you get used to doing the massage, I highly recommend adding more pressure and a little more massage technique to it. Not like a massage technique like this, but just a little more movement maybe. Just as you allow your body to relax and grow. As you do the massage too, practice breathing. I know we talk a lot about your breath during our yoga classes. Ujjayi breathing or just the counting breath. You can do a breathe in for 4, hold for 5, and out for 6 type of breath. Excuse my children in the background. I see them back there. So you can use this to practice your breathing so that when labor comes and you start to feel that pressure building and you start to feel that stretching and the ring of fire, your body will automatically begin to know, okay, I need to breathe through this pressure, through this uncomfortableness. And sorry, I'm trying to keep a track of what they're doing too. So you will just have this practice to fall back on, and hopefully help you in relaxing your perineum to allow your baby to come through, minimizing your potential for tears. Okay, so let's talk a little bit more about how to do this perineal massage. Now, when you get your 2 fingers, you can do 1 finger, 2 fingers, 2 fingers, 1 thumb, 2 thumbs. Again, whatever is comfortable for you. Play with it and get a feel for it. So if you're doing 1 finger, you're going to insert it into the vagina, right like this. Here's the perineum. So here's the downward area. This would be if I'm assisting someone. If you're assisting yourself, you're going to come in through this side. So I'm just going this way so I can show you guys, but you're going to put a finger in. You're going to begin to put some pressure. So I'll open my thumb to show the pressure. You can't see a whole lot. Just put as much pressure as you're comfortable. So you're going to put some pressure and then you're going to begin to kind of rub. This is why you need some lubricant. And just begin to rub that perineum nice and gentle. You can do 1 thumb here. It might be easier to do a thumb this way as you hook in and do that perineal massage here this way. Okay. You can do 2 fingers later, putting that pressure and just massage, going back and forth. You can do this for a few weeks leading up to your expected due date. Keeping in mind, babies don't always come on due dates. That's why it's an expected due date, but you're going to keep massaging and pressing down in order to stretch that tissue. See if it starts to give. You know how when you do a shoulder massage or a back massage, and you know how you can find that knot in the tissue? Essentially, that's what we're doing. You know how you put You know how when you put pressure on that knot in the tissue, that pressure over a couple of minutes, sometimes it's pretty quick, only seconds, sometimes it's minutes. It can be several minutes. But as you put pressure, you will start to feel that muscle kind of do this like twitching, almost ticking feeling before it just kind of melts away. And then that knot is gone. Essentially, that is what we're doing here. We are trying to increase the elasticity of that space. Just like when we're doing yoga and we have a really tight, maybe hamstring, more breath work in relaxing that muscle, because it is a muscle. It's not just tissue. It's all muscle wrapped around your vaginal input hole and your whole vagina. It's all muscle. So what we need to do is learn how to pinpoint that muscle and relax it. Breath work is a great way to do that, as well as that pressure, because we're going to feel a lot of pressure and our natural inclination is to pull away from it and tighten up. And if we tighten up and we pull away, we're going to increase our risk for tearing, and we're going to potentially increase the length of our pushing time through our labor and delivery. Okay. So again, you can have your partner, significant other, friend, family member, someone certified to do a perineal massage. You can have any of those individuals help you with this. And or you can do this all by yourself. It is up to you, whatever you feel comfortable with, but please give it a try, practice. Um, it always saddens me to see when moms tear during their labor. Sometimes it's just a minor tear. It could be just what they call a skid, like a rug burn type of thing, just as baby kind of comes out from that tissue tearing, tissue stretching. Sometimes it's a full-blown tear. Sometimes it's a 3rd degree, which you don't want a 3rd degree tear. But it happens, especially if you are expected to have a larger baby. I highly recommend doing perineal massage, especially if you have a larger baby expected. Their heads are bigger. It doesn't mean that you can't have your baby vaginally. It just means that we need to do a little more prep work. But you are absolutely, completely able to have that baby. So unless there's something else going on that I am unaware of as not your medical provider. Now, I found a couple of fantastic resources online that I will make sure to link in the bottom of this video. But AmericanPregnancy.org has some good videos and tips on how to get into a comfortable position to do the perineal massage. And we also have a great link for it's nct.org with UK. And then there's also pregnancy-birth-and-baby.org Australia that has some really great visuals that I will also link in the video below here. Just so that you guys have some good visuals to go along with the video. All right. Give that a try. Let me know how it goes. I'll put these links below so that you're able to read up on these techniques as well. And let me know how it goes. Ta-ta. Oh, make sure you follow us, like the video so I know that you want more of these types of videos. And welcome to Birth Tip Tuesday with Birth It Forward. I'm Brittany, certified birth and bereavement doula. Okay, I will talk to you again soon.